Good morning, everybody, and welcome back to another Get My Body Working video. Today, I would like to talk about the hip and how to fix it. Now, there are a couple of things that go on with the hip. One of them is really amenable to physio sorting out, which is what we call greater trochanteric pain syndrome. So that is pain on the outside of your hip. So if you find this sort of knobbly, big, bony bit here, this is what we call the greater trochanter. And essentially all your big bottom muscles, your glutes, attach onto it. And you can get either tendinopathy or bursitis in this area. And we call it pain syndrome because it's going to be one of those two things. Okay, now the treatment for it is actually fairly straightforward, but it's a bit of a slow one. It can take quite a while to sort out, okay? The first thing you've got to do is make sure you get the diagnosis right, but generally, if it's sore around this area, and if there's a sore bit in there that you poke around and find, and you go, that's pretty sore, or it's more tender in your bottom muscles here, it's highly likely to be greater trochanteric pain syndrome. Now, the other thing that people complain of with the hips is more joint related. So of course, I'm pointing here because this is where your hip joint is, okay? This bony bit is not really the hip joint itself. The joint's here more in the sort of anterior groiny area, okay? Now, the big thing there is obviously arthritis, okay? Another thing that you can have in there is a thing that's called femoral acetabular impingement syndrome. Essentially, that is another joint problem. And there are two types of impingement that you can have. One is where it's called pincer, where the acetabulum or the socket grows out some pointy bits that stick into the hip joint and cause some irritation. Or there's another one where the neck of the femur, that's what I was looking for, the neck of the femur gets thickened, which is called a cam deformity. Now, arthritis and hip impingement generally don't do so well with physiotherapy, particularly the impingement thing. So if you're having some joint issues here, certainly try some physio and everything I'm showing you here. But if it's not helping as we would expect, I think you definitely need to go and see your GP, get an x-ray, and be referred on to orthopedics for their opinions and advice. Okay, let's get back to greater trochanteric pain syndrome and what can you do? Okay, so first things first, let's differentiate between joints and pain syndrome, should we call it that? Okay, so let's have a quick check of your hip joint first. So we're going to do what we call the quadrant test, okay? This is going to hurt a little bit, so do it gently, okay? So pick a leg. This is my left leg, believe it or not. I'm going to bring it up, bring my knee up as far as I can go. And then with my left hand, I'm going to take hold of my ankle. I'm going to twist my leg in a little bit and just give it a bit of a stir around, okay? So this is going to compress and potentially irritate your joint. Even if there's nothing wrong with your joint, it can be a little bit uncomfortable. If there's something wrong with your joint, you're definitely not going to like this one, okay? So if you do that and it's sore in this groin area, it's probably more of a jointy problem, okay? Right leg, let's try this one. So up we go. Right hand this time, grab hold of your ankle there, twist that leg in, and a bit of a stir around, a bit of a grind, if I can use that word. How does that feel? Okay. Now, if you have a bad side and a good side, just compare the two. Okay. If the bad side's sore and not very happy with that, probably a jointy thing. If the good side was absolutely fine with that, suggest that maybe this is a jointy thing going on over there. There's a few other things we can look at which might be masquerading as OA or impingement. We'll get to that in a minute, but we're thinking jointy so far. Okay. So let's now have a look at what might cause your greater trochanteric pain syndrome, okay? So we're simply going to give your bum muscles a good stretch, those glutes, okay? So piriformis always goes first, no reason. So we're going to cross your leg like that, okay? Do this one a bit gently because it can be a bit sore. So now you want to sit up nice and tall, push your knee down, a good push, and then lean forward as far as you can. And you get a fairly strong stretch right in the middle of your bum. It might go down your upper thigh a little bit, might go into your groin a little bit, but how does that feel? Okay, come back and we'll swap the other side. We'll call this one the good side. This is my right leg. So we're going to sit up tall, push that knee down, lean forward. How tight is that one? And today that one feels a bit tighter, even though it's the good leg. Never mind. Okay, so how tight is that? Okay, now all the other gluteal muscles, we're going to give them a stretch now. So back on your left leg. So cross your leg over there again. This time we're going to get your knee and we're going to pull it across your body like that and just give everything a good stretch. Okay, how tight is that? Now there's a big muscle group here, so we're going to try a couple of different positions. So we'll call that the middle. For the lower muscles, we need to lift your knee up towards your chin and then pull that over. How tight is that? If that's tight, lower down. Okay, you've got to stretch this out in this position too. And then the last one is with your knees together like that. And we're simply going to grab your knee, pull everything over that way. You can use your lower leg to lever it over a little bit more. How tight is it up the top there? That's not always that tight, I find, but sometimes that can be very tight. Okay, so that's the bad leg, left leg. Let's try the good one over on the other side. So knee up there, foot up there, sorry. Grab your knee, pull it across your body. How tight are we in the middle? Very good. Knee up towards your chin, pull that over, the lower bit, and the upper part. Knees together, pull everything over that way. How tight is all of that? Now, if you are really, really tight on your symptomatic side, that is definitely an indication that you've got greater trochanteric pain syndrome going on down there. And those stretches will be instrumental in helping that resolve. Of course, you hold all your stretches for at least 1 minute, maybe 2, maybe even 3, depending on how long it takes for these things to loosen up. So the first stretch we do is the piriformis one, leg like that, sit up tall, push that knee down, lean forward, and you're holding that for a good minute or 2, which is a long time. Then coming back, grabbing your knee, pulling it across your body, and we check those 3 positions. So number 1 in the middle, if that's tight, a couple of minutes there, thank you. Pulling your knee up towards your chin, if that's tight, a couple of minutes there, thank you. And then if the knees together and pulling that over is pretty tight too, a couple of minutes there. So that's a lot of stretching to do if all of that's a bit tight. And of course, compare it to the other side, give that a good stretch. And if that side is tight, you might as well do that one as well, because you've got 2 legs, they've got to do half the work. There's no point having 1 good leg, you've got to have 2 good legs. Good, okay, excellent. Let's have a look at a few other things now that can contribute to this pain around your hip, okay? Okay, so we're in standing now, okay? So we're gonna look at some of the muscles at the front of the hip, obviously the groin muscles in there, hamstrings can play a bit of a role, but certainly your thigh muscles here, your big quads as well. So let's start with them. So I'm gonna grab a chair, okay? So this is my right leg now. So you quad stretch very simply, okay? Just fling your leg up and catch your ankle. Stand up tall, leg out the back, and give that ankle a good pull towards your bum there. How tight is it down the front of the thigh, okay? If that's tight, we're doing that one too, 1 to 2 minutes. Okay, let's try the other side. Grab that ankle there. How tight is that one? And as always, compare good and bad, okay? And of course, if the bad leg is tighter, you've got to spend more time doing that one, of course, okay? So that's your quad stretch in there. Your groin muscles, okay? So let's have your feet nice and wide. So it's nice and wide like that. And for the right leg, we'll do that one first. We're going to lean over towards the left. How tight is it up there in the groin? Hands on your hips, turn your hips to the left. How tight does that go around the front there? If it does, you're doing that one as well. Give that a good stretch, okay? Back to the middle, over the other side, and a bit of a twist. How tight is that one? And compare it to the good side. This is my left, the bad side, okay? So if that's tighter, that'll all be contributing to general unhappiness around the hip, okay? Hip flexors, really, really important muscle group, okay? They attach to what we call the lesser trochanter, which is all the way up sort of in there, okay? And that goes across your hip joint and all the way up the front of your lumbar spine, okay? So it's a really important hip flexor and lumbar stabilizer. So what's going on there? Now, left side. So leave your left leg behind. Step forward with your right leg, okay? Hands on your hips, lean backwards and sort of lunge forward. And maybe lean a bit more away from the leg at the back. So this time you're leaning over to the right. How tight is it down the front of the left hip here? Okay, how tight is that? And then we'll try the other side. So this time, left leg forward, right leg left behind, sort of a lungy type position. Hands on your hips, lean backwards, lunge forward. This time we're going to lean over to the left. How tight is it in this sort of right anterior hippie area? Okay. Now, just a little pause there. If you had pain in that groiny area and we were thinking hip joint, away, impingement, if those last two stretches were really tight, so your groin and your hip flexors, if they were really tight, your hip pain may have something to do with that. So this is where physio and stretches can be really, really effective down there. You don't know until you try, and it only takes a couple of days to loosen these things up, and then you get your answer. So nothing ventured, nothing gained there. Okay, now back to these hip flexor stretches, okay? Now, the standing version sometimes isn't that effective. So we're gonna try the kneeling version, okay? So just gonna stand up and press pause again, and then we'll get down to a kneeling position. So kneeling hip flexor stretch, my favorite, okay? So the leg you want to stretch, this is my right leg this time. Left leg in front there in a sort of a lunge type position, okay? So just have your front foot nice and wide so you get a good base of support. Okay, hands on your hips, lean back a bit, and then we're going to lunge forward and just give this front hip area a nice stretch, okay? Now, if that's really, really tight, there we go, stretch that out. To increase the stretch a bit more, your kneeling arm, so my right arm, you want to take that up over your head and then lean over a little bit as well. And just have a bit of a move around. See if you can find a nice tight area in this hip area. And then, of course, we're going to compare that to now the bad side. And, of course, if the bad side is tighter, then this is one we definitely need to add in, okay? So lunge position, front leg out, a little bit wider, of course, hands on your hips, glide forward, lean back, kneeling arm up and over, and just have a bit of a move around, lunge forward a bit more perhaps, and just get an idea of how tight that area is. Now, again, if that's really, really tight and indeed tighter than the good side, that's definitely one you need to add in. And again, if your hip pain was anterior over the hippie joint area, that stretch there, that hip flexor stretch is really, really, really effective, okay? Definitely hold all your stretchers for at least a minute minimum, okay? No more than 3 minutes because it gets a bit boring after that. I find 2 minutes is really effective. And then, of course, for maximum effect, breakfast time, lunch time, dinner time. So a few times throughout the day to give it a good loosen up. And it will only take 24, 48 hours to really loosen those things up. And then you get your answer. If everything's beginning to settle down, happy days. Back to your greater trochanteric pain syndrome, okay? The stretches will take a couple of days to loosen up, but it might take a week or two for the symptoms to actually start reducing, okay? And that's on account of the tendon in that area not having a wonderful blood supply, as tendons do. They don't have fantastic blood supplies. All that means is things are slow. Okay, the bursa in there also can take a while to settle down. Again, not wonderful blood supplies, slow. Okay, so don't despair. If you've loosened it all up and it's still sore, okay, just be patient with it and don't let it tighten up again. Keep stretching it, and it hopefully will catch up with you and settle down. The number of times I've had fairly skeptical patients come in with greater trochanteric pain syndrome, really, really tight glutes, I say to them, look, give it 2 weeks. You'll probably find it's magnificently better after that. And invariably, despite the skepticism, absolutely fine. Okay, let's have a look at how strong these muscles are, because this makes a big difference too. Okay, so we're going to lie down. We've got a mat here. So we're simply going to do a little strength test. Okay, so I'm going to lie down on my side. So we're going to have a look now, just how strong some of these glute muscles are, because that's a major thing that we need to find out. And that's a major contributing factor for basically any kind of hip and even low back pain problems. And that is how tight your gluteus medius and associated muscles are. Okay, so this is what I like to call how many times can you do it test. Okay, so you're going to lie down on your side, bottom knee bent, top leg straight, top hip, roll that forward, a bit like showing your bum to the ceiling. You can have your hand here on the floor or up here, doesn't really matter, okay? And essentially, how many times can you lift your leg up and down like that, okay? I'm going to take this to 50, 4, because 50 is a good number. And I'm no good at counting, so I'm going to call that 8, 9, 10. It's all about endurance. So we just don't go too fast, don't go too slow. 14, 15, 17, 18, 19, 20. Good stuff. 22, 23, 24. Feeling the burn yet? Good. 7, 28, 29, 30. Now 30 is the minimum I would expect you to be able to do, okay? So if you can't get to 30, this is big problems. And this is an excellent exercise to help you get there. I'm going to call this next one 40. If you're counting at home, I'm probably out by a little bit. We'll call that 43, 44, 45, 46, 47, 49, 50. And I could go on if I really wanted to, but I don't. So I'm going to stop there. Okay, so like I was saying, 30 is the minimum number I would expect someone to be able to do. Why? Because over the years, people who can't do 30 invariably have some kind of hip problem or some kind of back pain, and that's a huge contributing factor. And if they resolve that and they improve that, so they get to 30 and they get to 40 and 50 and beyond, then their symptoms generally start to improve, okay? I settled at 30 because if you couldn't do 30, as people got to being able to do 30, their symptoms began to improve, okay? Definitely check the other side, okay? I'm not going to do that now, so if you're at home, roll yourself over, get yourself in position, keep that lower leg bent, top leg straight, roll your hip forward, and away you go. How many can you do? The second leg will be a bit more difficult to do, so just hang in there. And you're aiming to get to 30 and then to 50, okay? Of course, you can just see how many you can possibly do. But again, I stopped telling people to do more than 50 quite a while ago because I found, even myself, that once you get to 50, if you actually need to have these muscles stronger, you really need another exercise. And I've made a lovely little video about that exercise, which is called, the exercise, it's a side lunge, basically. I think I've called back pain cure. So if you go back to my videos, that's the one I'm talking about. So that was fantastic. I mean, I could do, at one stage, I could do like 300 of these. And it improved my back, but it stopped. So 3 seems to be the optimum number before you need something else. Okay, cool. Right, very good, everybody. So I hope that's been very, very useful. That's what I would do with you if you came to see me with any kind of hip pain in my clinic. I'd check all of those things, gather that information, and see what that tells us. So just to recap, if your pain is in your sort of groiny type area, we're definitely thinking joint, either OA or impingement. Impingement generally comes about when you don't like having your knee or your hip flexed like that, squatting, kneeling, climbing over stiles, that sort of stuff. If you don't like that, probably thinking impingement. Do check all those stretches around there, make sure nothing's too tight, because things can get a bit squashed just by being tight. Loosen them up, they're generally a lot happier. If that doesn't improve things, definitely GP, X-ray, and get that checked and see what's. If the pain's on the outside and your glutes are really tight and they're very weak, you've got to strengthen them up. Now, of course, going back to how long it takes to strengthen your muscles, if you find that you can't do 30 or whatever, a couple of times a week, 3 or 4, as much as you can tolerate type thing, get those muscles tired, working hard, and build that up to at least 30, but definitely 50, good, better number. Takes 6 weeks to build your strength up. It might take you a few months to really get up to 50. And then once you get to 50, if everything's clearing up, or certainly hopefully along the way, if it's all clearing up, happy days. If it's not quite there and you feel you need to be stronger, go and check out my back pain cure video with that side lunge exercise and give that a try. And I'm sure that'll make a big difference. Awesome. All right. Well, thank you very much for watching. As always, like and subscribe if you don't mind. And hopefully it won't be so long before my next video comes out. Take care, everybody. Bye-bye.